Many people assume that circulation problems in the legs only appear when someone is older or already diagnosed with a vascular condition. The common belief is that if you can walk normally and do not feel severe pain, your circulation must be functioning well. In clinical practice, the picture is often more gradual. Circulation is not simply an on or off system. It is a continuous process that depends on several small mechanisms working together throughout the day. The heart pushes blood down into the legs with relative ease, but returning that blood upward requires assistance from muscles, veins, and specialized one-way valves. This process becomes especially relevant during long periods of sitting. Modern lifestyles often involve hours spent in chairs, at desks, in cars, or watching television. During these periods, the muscles that normally assist circulation remain inactive. When that happens, blood flow in the lower legs can slow temporarily. This does not necessarily indicate disease, but it does highlight how dependent circulation is on movement. Healthcare professionals sometimes refer to the calf muscles as a secondary pump for the circulatory system. Each time these muscles contract, they help move blood upward through the veins and back toward the heart. Understanding this simple relationship between movement and circulation raises an important question. If small muscle movements influence blood flow so significantly, what happens in the body when those movements are absent for long periods of time? Before answering that question, it helps to understand how circulation in the legs is commonly misunderstood. Circulation in the legs is often discussed only when a medical condition has already been diagnosed. Because of this, many people assume that circulation problems appear suddenly or only affect individuals with severe vascular disease. In reality, circulation changes typically develop gradually and are influenced by everyday behaviors such as movement patterns, posture, hydration, and muscle activity. One common misunderstanding is that circulation is controlled entirely by the heart. While the heart plays the central role in pumping blood through the body, the return of blood from the legs relies on several additional structures. Veins in the lower limbs contain small, one-way valves that help prevent blood from moving backward as it travels upward toward the heart. These valves work together with surrounding muscles, particularly the calf muscles, which contract during walking or other movements. Without regular muscle activity, the assistance these structures provide becomes less effective. Another source of confusion comes from how symptoms are interpreted. People sometimes associate circulation issues only with severe warning signs such as intense pain or sudden loss of mobility. However, early changes in circulation can be subtle and intermittent. Feelings such as leg heaviness after prolonged sitting, mild ankle swelling at the end of the
The
day,
heart pushes
or
blood
occasional
down,
nighttime leg
but returning it
discomfort are
upward
sometimes
needs
attributed
muscles,
simply to
veins,
fatigue or
and
aging.
one-way
In many
valves.
cases, these sensations can have multiple causes, and they do not automatically indicate vascular disease. Still, they highlight how sensitive circulation can be to daily movement patterns. Public messaging about circulation has also contributed to misunderstanding. Media discussions often focus on dramatic scenarios, such as rare but serious clotting conditions, which can overshadow the more common and routine factors that influence blood flow. As a result, the everyday role of muscle movement, posture, and hydration in supporting circulation receives less attention. To move beyond these misconceptions, it is useful to examine what medical research and public health organizations have documented about circulation and prolonged sitting. Understanding the available evidence helps clarify which observations are well supported and where scientific limitations still exist. Research over the past 2 decades has examined how prolonged sitting and reduced muscle activity influence circulation in the lower limbs. Much of this work has focused on measuring blood flow in the veins of the legs during periods of inactivity and comparing those measurements to conditions where muscle contractions are present. Several observational and experimental studies have documented that blood flow velocity in the lower leg veins decreases during prolonged sitting. For example, research published in peer-reviewed vascular and physiology journals has used ultrasound imaging to measure venous blood movement behind the knee and in the calf. These studies consistently show that when individuals remain seated and still for extended periods, the velocity of venous blood flow declines. This effect occurs because the muscles surrounding the veins are inactive and therefore not assisting the return of blood toward the heart. The Centers for Disease Control and Prevention, CDC, notes that extended periods of immobility can contribute to slower venous circulation in the legs. The CDC discusses this relationship particularly in the context of long-distance travel, where sitting for multiple hours without moving the legs may reduce venous blood movement temporarily. Public health guidance from the CDC encourages periodic leg movement during travel or other long sedentary activities as a general precaution to maintain circulation. Similarly, the World Health Organization, WHO, has highlighted the broader health impacts of sedentary behavior. WHO guidelines on physical activity and sedentary time emphasize that long periods of sitting are associated with several health risks when movement is consistently limited. These guidelines recommend incorporating regular movement throughout the day to support normal physiological processes, including circulation. Additional clinical observations have been documented in hospital settings. Research cited in medical journals such as The Lancet and BMJ has shown that early mobilization after surgery is often encouraged because gentle movement can support circulation and reduce complications associated with prolonged immobility. These observations have contributed to standard hospital practices where patients are encouraged to move their legs or walk as soon as it is medically safe. However, it is important to recognize the limitations of the available evidence. Many studies examining blood flow changes during sitting involve relatively small sample sizes or controlled laboratory conditions. While these findings demonstrate clear physiological responses to an activity, they do not automatically translate into disease outcomes for every individual. Public health organizations therefore frame their guidance cautiously. The general consensus is not that sitting itself causes vascular disease in otherwise healthy individuals, but rather that regular movement supports normal circulatory function and may reduce risks associated with prolonged immobility. Understanding these findings provides a useful foundation, but the evidence becomes clearer when we look more closely at the biological systems involved in circulation within the lower limbs. To understand how movement influences circulation in the legs, it is helpful to look at how blood normally travels through the vascular system. The circulatory system operates through a coordinated interaction between the heart, blood vessels, muscles, and specialized valve structures inside the veins. The heart generates pressure that pushes oxygenated blood through arteries and into the tissues of the body. Delivering blood to the legs is relatively straightforward from a mechanical perspective because gravity assists this downward movement. The challenge arises during the return phase when blood must travel upward from the lower extremities back toward the heart. This return process depends heavily on the structure of the veins and the surrounding muscles. Veins in the legs contain small one-way valves positioned at intervals along the vessel walls. These valves function as directional gates. When blood moves upward toward the heart, the valves open to allow passage. If blood begins to move backward due to gravity, the valves close and prevent reverse flow. This valve system helps maintain steady upward circulation despite the vertical distance between the feet and the heart. However, the valve system does not operate independently. It relies on external mechanical support from nearby muscles, particularly the calf muscles and muscles of the thigh. During walking or other leg movements, the calf muscles contract and relax repeatedly. When these muscles contract, they compress the veins that run through and between the muscle fibers. This compression temporarily increases pressure within the veins and pushes blood upward toward the next valve segment. Once the contraction ends and the muscle relaxes, the vein refills with blood from lower portions of the limb. The process then repeats with the next contraction. Because of this repetitive pumping effect, the calf muscle group is sometimes described in medical literature as a peripheral venous pump. Some clinicians informally refer to it as a second heart, although this phrase is primarily a descriptive analogy rather than a formal anatomical term. The effectiveness of this muscle-driven pump depends on several physiological factors. First, muscle activation plays a direct role. When muscles remain inactive for extended periods, such as during prolonged sitting, the compression that normally assists venous return occurs less frequently. Without these rhythmic contractions, blood may remain in the lower veins for longer intervals before returning to the heart. Second, venous valve function influences circulation efficiency. Over time, valves may lose some elasticity or structural strength due to age-related tissue changes. Medical research indicates that these changes can gradually affect how effectively valves close and reopen. When valves function less efficiently, blood may remain in the lower legs for longer periods before moving upward. Third, fluid balance and blood viscosity can influence circulation. Adequate hydration supports normal blood volume and viscosity, which affects how easily blood moves through vessels. Dehydration may temporarily increase blood viscosity, meaning the blood becomes slightly thicker. This can influence the resistance blood encounters when traveling through smaller vessels. Fourth, body position can influence pressure within the veins. When a person sits with the knees bent for long periods, the angle at the hip and knee joints can slightly compress certain venous pathways. While this effect is typically temporary and resolves with movement, posture can influence how easily blood flows through the lower limbs. The nervous system also contributes to circulatory regulation. The autonomic nervous system controls subtle adjustments in blood vessel diameter through a process known as vasodilation and vasoconstriction. These adjustments help maintain stable blood pressure and appropriate blood distribution during changes in activity, posture, or temperature. Taken together, these mechanisms illustrate that circulation in the legs is not driven by a single organ or structure. Instead, it relies on a coordinated system involving the heart, blood vessels, muscles, and nervous system regulation. Understanding how these systems interact helps explain why small amounts of regular movement can influence circulation. Even modest muscle contractions can assist venous return by activating the mechanical pump created by the muscles surrounding the veins. The implications of these mechanisms become clearer when considering how circulation patterns may influence long-term health outcomes. Understanding how circulation functions in the lower limbs helps explain why long-term patterns of inactivity may influence overall vascular health. Medical research generally describes these effects in terms of probability and risk factors rather than guaranteed outcomes. When blood flow slows in the veins of the legs for extended periods, fluid may remain in the lower tissues longer before returning to the heart. Over time, this can contribute to mild fluid accumulation in the ankles or lower legs, particularly after a full day of sitting or standing. Healthcare providers sometimes refer to this as dependent edema, a condition that often improves with leg movement or elevation. Large population studies have also examined the relationship between sedentary behavior and broader cardiovascular health. According to reviews summarized by organizations such as the World Health Organization, WHO, and the National Institutes of Health, NIH, prolonged sedentary time has been associated with increased risk of several chronic health conditions when it occurs consistently over many years. These may include cardiovascular disease, metabolic disorders, and reduced physical function in later life. Importantly, these relationships are typically identified through observational research, meaning they show statistical associations rather than direct cause and effect in every individual. Circulatory efficiency can also influence functional capacity. Efficient blood flow supports the delivery of oxygen and nutrients to muscles and other tissues. When circulation is supported by regular movement, muscles tend to maintain a better endurance and recovery during daily activities such as walking, climbing stairs, or standing for extended periods. Conversely, prolonged inactivity may contribute to gradual reductions in muscle efficiency and mobility over time. Another area of interest in medical research is the difference between lifespan and health span. Lifespan refers to the total number of years a person lives, while health span describes the years spent with good physical function and independence. Many public health initiatives now emphasize maintaining mobility, circulation, and muscular strength as part of supporting a longer health span. Although circulation-related changes can occur gradually, they are often responsive to lifestyle patterns. Small, consistent behaviors, such as regular movement during long sitting periods, are commonly included in public health recommendations aimed at supporting vascular health and overall physical function across the lifespan. Medical guidance regarding circulation, physical activity, and sedentary behavior is largely shaped by consensus statements from international health organizations and national public health agencies. Although specific clinical recommendations may vary across medical specialties, there is broad agreement on several foundational principles related to circulation and movement. The World Health Organization, WHO, released updated guidelines on physical activity and sedentary behavior that emphasize reducing prolonged sedentary time and incorporating regular movement throughout the day. According to these guidelines, adults are encouraged to accumulate moderate physical activity each week and to interrupt long periods of sitting with light activity when possible. The WHO notes that even short bouts of movement may contribute to maintaining normal physiological processes, including circulation and metabolic function. Similarly, the Centers for Disease Control and Prevention, CDC, advises individuals who spend long periods sitting, such as during travel or desk work, to periodically move their legs, stand, or walk when feasible. The CDC presents these recommendations as general public health precautions rather than treatment strategies. Their guidance reflects evidence showing that movement supports healthy blood flow and overall cardiovascular function. Professional medical associations also emphasize the role of mobility in maintaining vascular health. Clinical resources referenced by organizations such as the American Heart Association, AHA, and the National Institutes of Health, RENIH, highlight that skeletal muscle contractions assist venous return in the lower limbs. As a result, routine leg movement and regular physical activity are widely recognized as beneficial for circulatory function. At the same time, experts acknowledge that several areas remain under active investigation. Researchers continue to study how different patterns of sedentary behavior affect long-term vascular outcomes, as well as how factors such as age, existing medical conditions, and overall fitness influence individual risk. Overall, the current consensus in public health is consistent. Maintaining regular movement and avoiding extended periods of uninterrupted sitting are practical strategies that support normal circulatory physiology. While circulation is influenced by many biological factors, several general lifestyle practices are commonly recommended in public health guidance to help support normal blood flow and overall vascular health. These recommendations focus on broad behavioral patterns rather than individualized medical treatment. One widely supported principle is regular movement throughout the day. Public health organizations such as the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, emphasize the importance of interrupting long periods of sedentary time. For individuals who spend extended hours sitting, whether at work, during travel, or at home, short breaks that involve standing, stretching, or walking can help activate the leg muscles that assist venous circulation. Another important consideration is hydration. Adequate fluid intake supports normal blood volume and circulation. While specific needs vary between individuals depending on climate, health status, and physical activity, maintaining regular hydration throughout the day is generally encouraged as part of overall health maintenance. Posture and leg positioning may also influence comfort during prolonged sitting. Maintaining a neutral seated posture and occasionally adjusting leg position can reduce sustained pressure on certain areas behind the knees or thighs. Some healthcare professionals also recommend periodic ankle or calf movements when standing or sitting for long durations, especially during travel. It is important to note that these general practices are intended for health maintenance and prevention. Individuals experiencing persistent swelling, pain, sudden changes in circulation, or other concerning symptoms should consult a qualified healthcare professional for medical evaluation. These everyday habits are often discussed as part of broader strategies to support cardiovascular and musculoskeletal health across the lifespan. Circulation in the legs is often discussed only when a medical condition becomes visible or uncomfortable. Yet the underlying physiology shows that circulation is a dynamic process influenced by everyday behaviors, especially movement patterns throughout the day. Medical research consistently demonstrates that the return of blood from the legs to the heart depends not only on the heart itself, but also on the coordinated action of veins, valves, muscles, and the nervous system. When the muscles of the legs contract during walking or other movement, they help support venous blood flow through a mechanical pumping effect. When movement is limited for extended periods, that assistance becomes less active. Public health guidance from organizations such as the World Health Organization and the Centers for Disease Control and Prevention therefore emphasizes the value of reducing prolonged sedentary time and incorporating regular movement into daily routines. For most individuals, maintaining circulation does not require complicated interventions. Consistent physical activity, periodic movement during long sitting periods, and general health maintenance practices can all contribute to supporting normal circulatory function. Understanding how these systems work provides an opportunity for individuals to make informed, sustainable choices that support mobility, circulation, and overall well-being over the long term. This content is provided for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any medical condition. The information presented reflects general public health guidance and summaries of medical research, but should not be interpreted as personalized medical advice. Individual health needs may vary depending on medical history, medications, and existing conditions. If you experience persistent leg swelling, severe pain, sudden changes in circulation, or any other concerning symptoms, consult a qualified healthcare professional or licensed medical provider for evaluation. Always seek professional medical guidance before making changes to your health routines, especially if you have a diagnosed cardiovascular or vascular condition